aging, we talked about how important it is in MS prognosis, but we also need to consider sex and hormones in the spectrum of age. And we see specific sex differences throughout the disease course in MS. First of all, when we think about the transition from the radiologically isolated syndrome to the symptomatic MS onset, we see that being a male is an important risk factor. Also, when we look at the relapses with more inflammatory activity in women, we see that the relapses are more common, but at the same time, they tend to recover better compared to men. But when we look at men, men tend to have less inflammatory activity, and therefore they have less frequent relapses, but they are likely to have poorer recovery from relapses. Another thing we need to consider is the transition to the progressive phase and the disability accumulation and how it is affected differently by sex and hormones. We see that women enter the relapsing phase at an earlier age, but men enter the progressive phase earlier. And in the relapsing-remitting phase, men accumulate disability faster, while once women enter the progressive phase, they seem to accumulate disability faster compared to men, and in a way they kind of catch up with men in terms of disability accumulation. And radiologically as well, we see that men, since they have lower inflammatory activity, they tend to have fewer T2 hyperintense lesions, they have fewer enhancing lesions, but they have more T1 black holes, they have more atrophy, and they have more slowly expanding lesions, and all these also translates into more disability. And then we need to look at reproductive milestones as well and how they are associated with MS prognosis. For example, when we look at pregnancy, we see that pregnancy is associated with better outcomes in the long term. And when we look at menopause, on the other hand, we see that the stability actually is higher around that time. And in men, interestingly, with the physiological age-related decline in the hormonal levels in men, we also see it coincides with the transition to the progressive phase.